What makes me think I can be a strong advocate for people with disabilities? This is a start. I was saddled with this crutch after a workplace injury in 1996. That started a long struggle with workman's comp and private insurance that has shown me the failures of our healthcare system. You see, I needed two crutches after my injury, and I had to fight to get down to just needing one, and I do mean fight. I had to fight doctors, clinics, insurance companies, lawyers, and my employer just to get someone to fix my ankle well enough to need only one crutch. Even still, I had to go on disability and Medicare. I was able to change careers and stay self-sufficient, but after 5 years working as a realtor, a car accident set me back again. This time I faced an even steeper battle to get on disability. Why? Because I was hurt worse than before. There were times I got so discouraged I wanted to give up, but I wasn't raised that way. I filed a disability appeal, which if anyone has ever had to do that, you know it can take ages. After months of fighting, I was finally able to get through the right person. An SSI disability appeal judge called me one day. I picked up the phone and without even saying hello, he asked me, "Am I reading this right?" He was flabbergasted by what he read in my appeal. He said, "If I ever see an appeal like this again, I will personally drive to that office and see heads roll. I apologize for your inconvenience, and since you have been disabled this whole time without income, you will get reimbursed for that too." It was a huge weight off my shoulders, but I realized there were a lot of folks like me facing similar hardships. I started using my experience to help others. I help people write appeals on denied claims. I help those with mobility issues more severe than mine get the support they needed. I help my parents apply for Social Security and Medicare, get life-saving medical equipment, and navigate the so-called Medicare donut hole that leaves people holding the bag when prescription coverage dries up. And during my mother's long battle with cancer, I helped work with her insurance to coordinate treatment coverage and ultimately the end-of-life care so she didn't have to do it alone. None of it was easy, but it all needed to be done. I have fought tirelessly to make sure everyone can access the care they need. I know how to cut through the red tape and make sure the people responsible for providing the access to health care and financial assistance do their jobs. But it isn't enough to hold people accountable. Our system is broken and it needs to be fixed. So let me ask you this. Who would be better to step up as an advocate for healthcare for all than someone who's been through it all and seen firsthand just how broken our system is? I'm John Holm, and I'm asking for your support to build a better Oregon together.